Let's talk about the expanded scope of practice. So paramedics more recently than not have expanded their focus, or their scopes of practice, so to speak. So we start with 911 response. So somebody calls 911, we kick on the lights and sirens, we drive real fast, and we show up. We jump out with all our bags, our monitors, our drugs. We go do things. We throw them on the cot, throw them on the back of the ambulance, and we drive to the hospital, and then we're done. Traditional 911 response. Now we've got interfacility transport. So does it take a paramedic to do every interfacility transport? No, just like it doesn't take a paramedic on every 911 response. So we've expanded to critical care transport, CCT. There is also the critical care paramedic certification, which is not a state certification or license. It is kind of like ACLS or those, just expands upon our knowledge that we already have and has us look at it in a new way, introduces us to new medications and stuff like that. So CCT is kind of equal to the CCEMTP. All depends on what course you take. There's multiple different ones out there. There's the FPC, which is the flight paramedic certified. Oop. FPC, CCT, both kind of go together. And then, of course, the CCEMTP, it's kind of the same thing. They all have expanded knowledge, expanded use of current knowledge, different ways of looking at things. These tend to go into HEMS, or helicopter EMS, helicopter emergency medical services. Helicopter response. Helicopter does two things. They do interfacility and scene response. Based at either a remote location or hospital based. Same with 911 response. You can be based at a hospital, or you can be based remotely at a station, wherever they want you to be, or wherever they have it set up at. Then you have TEMS, which is tactical. So most likely you are a police officer, or you are a deputized paramedic. Or you can just be a civilian paramedic that is trained in tactical EMS. Military. Many corpsmen are certified as paramedics or AEMTs, depending on what the military needs at the time, what their unit needs and requires. This is another option. Once you have your paramedic certification or licensure, you can pursue all these expanded scopes of practice. Community paramedic. They follow a curriculum that is very similar to nurses for the home health. They provide some of the same services, and they may expand on others. Industrial medicine. Beef packing plants. Offshore oil rigs. Automotive manufacturing, aircraft maintenance and manufacturing, Many of these industries have moved to having certified paramedics with specific training into their areas, or they provide their own training to a paramedic that they may have hired from a civilian service or from military or from what have you. Our education base provides us with the opportunity to go many different places and to focus in on specific things if we choose to. Sports medicine. Some EMS personnel are moving into sports medicine, working with sports teams, working with athletic trainers, working with doctors to take care of athletes. Corrections. Working in the prison system. Working with correctional facilities. Working within the jail as a response with either a TEMS team, a goon squad, depending on what you call it and what your local corrections facility calls it, or you may just be in the sick bay. You may be that first line before the nurse practitioner, PA, or doctor sees that patient. You do the triage, you do the vital signs, you do whatever needs to be done to stabilize while being seen or prior to being seen by those other specialties. ER. There has been a big move to moving paramedics with a scope of practice similar to that of nursing into the emergency rooms. Much of nursing education is very broad, and you get specific education when you get to the floor or the unit that you're going to work on. The emergency room, we are already geared towards that thought process. We work well in emergency rooms. We know the language. We know the procedures, most of them. We know the medications. Those that we don't know, we can be trained very easily and quickly. We adapt well to the change and the flow of the ER. This is a good place to get great experience, especially as a new medic, if your area allows it. So we talked about critical care transport. Vehicles to move patients between facilities. Helicopters, airplanes, ground ambulances. So our critical care transport, our critical care paramedics, our flight paramedics, our medic RNs that are cross-trained, that are dual licensed, dual certified, whatever you want to call it. They are specialized ground ambulances. They have more oxygen carrying capability on the ambulance. They have expanded drugs within their drug boxes. They have an expanded array of drugs depending on what's going on, depending on what they're transporting. They have a wider knowledge base of medications into antibiotics, into blood administration, into pressors, into drips, intra-aortic balloon pumps, splinting, post-surgical complications, chest tubes, you name it. Critical care paramedic bridging into the ICU. Think of it that way. Moving towards ICU. So you're moving from a little hospital to a big hospital. From lower level of care to higher level of care. That transport needs somebody, some people, some technicians, some healthcare professionals that are able to provide the level of care that the higher level of care is going to take over or to implement. if that's necessary, from ICU here to ICU here. An ALS transport, an ALS transfer. That falls back on the advocacy. Are we advocating for our patients if we are not fully comprehending their condition and arguing for a more appropriate mode of transport? They may have called us for a ground transport, but they may need air. Or they may need something before we even leave. Because the back of the truck is a lonely place, 150 miles away from home, and nowhere around to help. Fixed wing. We talked about fixed wing. We talked about helicopters. Most, not all, a lot of critical care transport vehicles specialized, specifically built for critical care transport are larger ambulances on medium truck chassis. Heavier duty, they carry more stuff, they carry more weight, they carry more people. I invite you to go look at Cardinal Glennon Children's Hospital has a helicopter. They have 2 helicopters. They also contract with Air Methods for their service. St. Louis Children's Hospital has their own. They have 2 helicopters. They have 3, I believe, ground ambulances that are huge ambulances that are fully equipped. They have crew cabs. They can carry a large crew. The back end of the ambulance can do anything that their emergency room can do and maintain any level of care that their ICU maintains. And so can their nurses and their paramedics. Helicopter ambulance services. Staffed with 2 medical crew members, generally an RN and a nurse. It could be an RN and a respiratory therapist if it's a hospital-based and it's intra-facility. Flight paramedics, if it's a scene response or if they do scene response, generally we'll have a paramedic on board. Not all states are equal. Not all states are the same. But a paramedic is flexible enough generally to do both, intra-facility and scene response. We are trained for the scene response. We can pick up the ICU side of things as we go, or we can be taught that to begin with before we ever set foot on the helicopter. Nursing generally is the in-hospital care, the ICU level care. They have the expanded drugs, knowledge, the antibiotics, the pressors, all the different medications outside of the general EMS drug catalog. Not saying that we as paramedics don't have that. Some of us do and some of us gain it. However, right out of school, generally we don't have that. ICU nurses don't. Helicopter EMS generally requires 3 to 5 years of emergency room, ICU, and or pre-hospital experience with a busy service. Now, it all depends on what they define busy as, but they will discuss that with you as you apply and as you expand into that. Tactical EMS, they enhance the safety of special operations personnel and the public. So you can be either a paramedic with a tactical team that makes entry into the home and your primary focus is your team. You could be a tactical paramedic that responds with the tactical team, but you stay outside with other officers behind cover and concealment. Many are cross-trained as police officers and do carry sidearms. You can be a civilian unarmed medic on a tactical team, and you can make entry that way as well. It's all up to you, your local law enforcement, and what everybody's willing to do. You perform life-saving care in austere conditions, dangerous environments, until the patient can be safely evacuated. You may not be staying and playing. You may be just plugging a hole and dragging out. It all comes with experience and training. A start would be taking TCCC or TECC. Gives you a basis to start from. As we get into, again, the critical care paramedic, not the critical care paramedic, the community paramedic, they work in close contact with medical direction, and they provide care at the scene without transport to the hospital. Some of these community paramedics are learning and have been trained in providing sutures. They may or may not give an antibiotic. They may, again, as mentioned before, they may make appointments for the patient at their local doctor's office. They may set up a appointment with them at a local clinic. And they're also specialized crews to periodically assess and monitor high-risk patients in the community. So you've identified a high-risk patient. They are a frequent flyer. They call all the time with the same problem. Well, they get put on a list. And these people, certified or trained as community paramedics, may respond in a response vehicle, such as they may have an ambulance, or they may have something like a Suburban or a car, and they respond to the home and they check on this patient. They make sure that their prescriptions are filled. They make sure that they are taking them appropriately and correctly. They help divide them into the little pillbox dividers. They may help, they have a good working knowledge of the local charities or the local resources for low income or what have you, whatever the problem is. They have the resources, they know the resources enough to point them in the right direction and to help them apply for these benefits. They may know the local home health organization and what they need, and the patient just doesn't know how to get on with home health for a regularly scheduled visit. They may not have the resources to do it, but they qualify for a resource that they just don't know about. This is what community paramedicine is part of, is they group that public health, they group that health care, and they provide and they enter them into the healthcare system where they are cared for and where they have the resources and the ability to make it to appointments, to get transportation, to get their meds filled and their prescriptions held, and or get affordable prescriptions. Maybe there's a alternative that they don't know about or what needs to be done. Within the industrial medicine, they go in, they take part in safety inspections. They're versed in OSHA requirements. They help with accident prevention. They help teach how to prevent accidents. No loose clothing, hair pulled back around rotating and equipment, that kind of thing. Medical screening for employees. Maybe there's a pre-employment health screening. This is something that you're going to do. Pre-employment and post-accident drug testing. That is something that you would do. Patient comes in with a problem, or an employee comes in with a problem. They have a headache. You're assessing. You might be giving them Tylenol. It's all dependent on what your policies and procedures are with that company. You might be providing vaccinations and immunizations. Maybe the company provides that kind of thing. Increase employee safety. You're there for multiple reasons. You are there to help with safety. You are a faster response than a normal 911 response. You have an expanded scope of knowledge that is more beneficial than potentially the RN or whatever health safety official they have. You have the treatments and the equipment to handle as if it is a normal EMS call. You are decreasing the lost amount of time from work. You are increasing employee productivity while you're there. That is part of your job. You also help lower insurance rates for a lot of these places. If they have a paramedic on staff, on site, their insurance rates drop because you are helping with all of these things. Oop. Sports medicine, injury prevention, injuries specific to sports. So you may have an expanded knowledge base into orthopedic injuries and the splinting and the resetting of dislocations, or dislocated fingers, shoulders, knees, ankles, the splinting of broken bones, the resetting of bones. You may have this training and stuff that they do on site with the physicians. In the corrections medicine, initial prisoner medical intake assessment, you're going to set them down and you're going to go over their medical history. You're going to get a full history, full assessment on this patient. You're going to do blood pressure, vital signs, find out what's normal. Do they take medications? What medications do they take and why? Have they had surgeries? Is there anything that you need to watch for? What conditions? Are they diabetic? Are they hypothyroid? Are they hyperthyroid? Are they, what's going, do they have a TBI? These are all things that you're going to find out. You're going to oversee the medical needs of the prison population and during emergencies. You're going to get intimate knowledge on these guys, more so than you would if you were a street paramedic, almost to the level of a doctor, a family doctor, depending on how many are assigned to your service and if it's a rotating thing or if you're assigned. In the hospital, in the emergency room, the roles are vary state to state as to what you can do and what you are allowed to do. It also is a lot of semantics. There's a lot of who are you hired under? Are you hired under physician services? Are you hired under the nursing department? Are you hired under, and that all plays into the what the Nurse Practice Act says you can do. If you're licensed, if you're certified, there's a lot that plays into this. Specific roles and things per state, per hospital, per company will depend on exactly that. What state you're in, what company you work for, what hospital you work for, and what they are allowed to let you do. It would be important for you, if you're going to look into that kind of job, to find that out prior to applying or asking it during the interview process and seeing if that's something that you're interested in. That role is to assist medical and nursing staff with skills and responsibilities within your scope of practice. And that will be defined on, again, their policies, procedures, who you're hired under, what rules, what legal state regulations and statutes that falls under, and how that all plays out. Some places have paramedics that have full scope of practice and take patients just like nurses do. Other places are a lot more restricted down. We are a recognized staple in the healthcare system. We do many things that no other branch of healthcare or no other area of healthcare does. We are very underutilized. There's so much more that we can do with our basis of training and our knowledge base. It's starting to open up. We need to be good stewards of that. We need to embrace it, and we need to push ourselves beyond. We need to be good ambassadors of our profession, of our education, of our knowledge, and of our skills. We need to take part in public education. We need to give public health. We need to take part in public safety demonstrations. We need to be out there, and we need to promote ourselves. The scope of paramedicine continues to expand, and so will the demand for skilled providers. Just as nursing is branching off into doctorate of nursing practice, nurse practitioners, EMS can and should follow suit, in my opinion. We should be able to expand our stuff, our skills, our knowledge. PA is a wonderful branch into that mid-level practitioner area that paramedic really, really lends itself well to. nursing as well. We have a lot of very specific knowledge, yes, but combine that with nursing knowledge and your opportunities open wide, educational and professionally. We are the first member of the healthcare system with the patient interacts. Now, that's not the chain of survival, that's the healthcare system. Now, paramedic, yes, we are one of the first. If the local service is a paramedic service, it could be a BLS service, it could be an EMT. The responsibility and the steward of our profession relies on them as well as on the EMT as well. As paramedics, though, we are expected publicly, professionally, that we know more. Our breadth and our depth of knowledge is greater. And we need to use and utilize that to the best of our abilities for the best for our patient. Our interaction with the public and with our patients dictates how the public and our patients look at us. Falling back on the ability to develop rapport with any patient or with a wide variety of patients. Some patients we just can't connect with, but maybe your partner can. There's been plenty of calls where the patient just didn't want nothing to do with me, so I had my partner take over, if appropriate and if equal level of certification. But that's what you have to do. Put pride aside. Yeah, it may be your jump and it may be your call and you may be elbow deep in this, but if they don't have any rapport with you and they don't want to develop it, but they're talking to your partner, let your partner take over. Let that good come out. Let them have a positive experience with EMS, as positive as possible, because we are not called to very many positive things. Let the positive take over. Give them the care that they need. Make a positive impression and promote that. You can make a difference in this profession. You will make a difference in somebody's life, whether you realize it or not. Be it you an EMT or an AEMT already, you may have some nursing behind you as well. You are going to greatly affect more people than you realize. You are in the public's eye all the time. And every call and every patient interaction is different and can make the difference between life and death. That positive interaction may stop a suicidal person from attempting. Your positive interaction with a person may make that difference. Your knowledge and judgment and application of skills may save the cardiac arrest patient. May stop the person from bleeding out. May make those differences. And not only are making a difference in that person's life, but their families, because now that person is still there for their family. We can make the difference every day, and that's what we need to do. And we need to treat it like that.